Welcome. You are listening to IJD in Focus, the monthly podcast series of the International Journal of Dermatology, featuring the latest editor's highlights and a summary of our open access publications available to everyone.
Targeted therapeutic advances in autoimmune blistering diseases have renewed attention to diagnostic precision, disease classification, and clinically relevant subgroups. In this issue, we focus on two aspects of this evolving field: recent developments in the diagnostics of autoimmune blistering diseases and the clinical features of checkpoint inhibitor-associated autoimmune blistering diseases and their treatment options. These contributions illustrate how therapeutic innovation, diagnostic progress, and recognition of emerging clinical contexts are closely interconnected.
We begin with a viewpoint by Awadallah et al., examining the growing dermatologic implications of glucagon-like peptide-1 receptor agonists. The dermatological field faces a pressing paradox. GLP-1 receptor agonists prescribed for metabolic conditions show dual potential: therapeutic benefits like reducing psoriasis severity by 52.4% with semaglutide, and serious cutaneous risks, including rare but severe reactions, such as bullous pemphigoid and accelerated facial aging. The mechanisms behind these divergent outcomes remain unclear, leaving clinicians without tools to predict who may benefit or suffer harm. Despite increasing evidence, predictive biomarkers and risk management strategies are lacking, creating a critical gap in patient safety. Dermatologists must lead efforts to monitor, report, and research these effects, ensuring evidence-based guidelines to protect patients and advance scientific understanding.
Next, we discuss autoimmune blistering diseases and the challenges posed by immune checkpoint inhibitors. A review by Dines et al. Examines mucous membrane pemphigoid after anti-programmed cell death 1 therapy, management of high and low-risk mucous membrane pemphigoid in this setting, and the potential oncologic trade-offs remain poorly defined. The authors performed a narrative synthesis of all published cases of anti-PD-1-associated MMP. 15 cases met the inclusion criteria, with a median mucous membrane pemphigoid latency period of 12.5 weeks. The oral mucosa was frequently involved and was the index site in 84.6%. Ocular involvement was observed in only one patient and resolved with topical corticosteroids. Anti-PD-1 therapy was successfully continued in 3 low-risk cases with systemic steroid treatment. Overall, doxycycline plus topical corticosteroids produced the best low-risk response. 5 of 10 low-risk patients were treated with doxycycline plus topical corticosteroids, and all 5 achieved complete remission at least at one anatomic site. High-risk mucous membrane pemphigoid required escalation with methotrexate, rituximab, and slash, or intravenous immunoglobulin. Anti-PD-1-associated mucous membrane pemphigoid is typically oral predominant and, unlike classic form, has infrequent ocular involvement. When anti-PD-1 therapy continuation is clinically prioritized, a systemic steroid-based regimen can stabilize mucous membrane pemphigoid and facilitate completion of immunotherapy.
We next turn to genetic risk and skin cancer screening practices among high-risk individuals in an original article by Freeman et al. There is a lack of knowledge in full-body skin examinations in the context of pathogenic or likely pathogenic variants in skin cancer predisposition genes. This study highlights the need for comprehensive guidelines beyond known risk factors to optimize skin cancer screening in high-risk populations.
Galili et al. Present an original article on a practical approach to the assessment of longitudinal melanonychia. Longitudinal melanonychia may represent subungual melanoma, yet clinical differentiation from benign longitudinal melanonychia remains challenging. Intraoperative dermoscopy improves diagnostic accuracy but requires specialized equipment and time. Intraoperative nail matrix examination, a direct visual inspection without magnification, may provide a simpler alternative. The authors found that intraoperative nail matrix examination is a simple, equipment-free intraoperative tool that improves clinico-pathologic correlation, aids in distinguishing subungual melanoma in situ from benign longitudinal melanonychia.
We continue with a challenging genodermatosis and a potential new therapeutic approach. Justice et al. Present the effective management of recalcitrant Hailey-Hailey disease with risankizumab. Hailey-Hailey disease, A rare acantholytic dermatosis, causing painful erosions and plaques in skin folds, is notoriously difficult to manage. A 56-year-old woman with recalcitrant Haley achieved significant improvement after 6 months of risankizumab, an interleukin-23 inhibitor, alongside continued dapsone and azathioprine. Her quality of life improved dramatically, with reduced pain and fewer erosions. This case highlights risankizumab's potential as an off-label treatment for severe Haley disease.
Our next article is a short communication on an uncommon and potentially distinct subtype of bullous pemphigoid. Magli et al. Researched BP230 type bullous pemphigoid, a rare subset of bullous pemphigoid associated with a favorable prognosis. Bullous pemphigoid, BP, is the most common autoimmune blistering skin disease, often driven by BP180 autoantibodies, though a rare subset involves BP230 immunoglobulin G. A 3-year study identified only 5 true BP230 type BP patients, 3.4% of 147 cases. All female, most with non-bullous variants such as prurigo-like or eczematous presentations. These patients responded well to mild therapies, including topical steroids and low-dose prednisone, with rare relapses and no need for immunosuppressants, suggesting a benign prognosis. Commercial enzyme-linked immunosorbent assay-negative B, P230 immunoglobulin G cases often react to full-length BP180, highlighting diagnostic challenges. True, BP230 type BP likely presents atypically, warranting less aggressive treatment. Further research is needed to clarify BP230's role.
Another short communication by Gallo et al. Introduces a practical scoring system for an often overlooked manifestation of alopecia areata. Beard involvement in alopecia areata is common but poorly assessed in clinical practice. Existing tools focus on the scalp or require complex calculations, leaving a gap for a simple, beard-specific scoring system. The proposed beard score divides the beard into 6 regions, assigning 1 point per affected area for a total score of 0 to 6. Severity is categorized as mild, moderate, or severe. This visually based, easy-to-use tool aligns with patient-reported psychological impact and could serve as a practical endpoint in research and trials. However, validation is needed to confirm its reliability, sensitivity to change, and correlation with distress. Current data suggest no regional predilection, though further study is required.
In a short communication by Bestavros et al., the authors examine the association between frontal fibrosing alopecia and inflammatory genital disorders. Frontal fibrosing alopecia, a scarring form of hair loss characterized by progressive frontotemporal recession, may co-occur with genital lichen planus or lichen sclerosis, causing pain and itching. A review of 67 cases found that frontal fibrosing alopecia with lichen planus occurred only in women, while frontal fibrosing alopecia with lichen sclerosis affected both women and men. Scalp involvement was universal, with varying rates of eyebrow loss. Genital symptoms often preceded frontal fibrosing alopecia, sometimes by several years. However, underreporting and small sample sizes limit conclusions. Clinicians should screen patients with frontal fibrosing alopecia for genital symptoms and report cases to improve understanding.
Our next study highlights important disparities in sun damage recognition and photoprotection education. Williams et al. Evaluate sunburn awareness and post-exposure symptoms in self-identified people of color. Although people of color experience lower skin cancer rates, they face higher morbidity and mortality due to delayed diagnoses and under-recognized sun damage. A cross-sectional survey of 1,069 United States adults revealed that many people of color who never reported sunburns still experience post-exposure symptoms such as warmth, headaches, dryness, and peeling. Different skin tones reported different manifestations of sun injury, and people of color were less likely to have dermatology visits. These findings underscore a critical gap in how sunburn and ultraviolet damage are perceived across skin tones, suggesting that traditional descriptors in education materials fail to capture the diverse ways sun injury manifests in people of color. Improved inclusive photoprotection education is urgently needed.
Nazikone et al. Examine the quality of referrals for potentially malignant skin lesions and efforts to improve triage and access to care. Canada diagnoses 80,000 skin cancers annually, with 5% being melanoma, yet long wait times for specialist referrals risk delayed treatment. A Delphi study involving dermatologists, plastic surgeons, and otolaryngologists reached consensus on 80 essential referral components, including personal and family history of melanoma, while excluding dermoscopy descriptions and psychosocial factors. Dermatologists prioritized broader skin cancer histories and full-body examinations, whereas surgeons focused on billing and immediate family history. Photographs and detailed morphology were not deemed essential, but plain language descriptions sufficed. The study highlights systemic challenges such as specialist shortages and low reimbursement rates, which delay care. These findings aim to standardize referrals, improve triage efficiency, and reduce unnecessary biopsies, though broader validation is needed.
Barnawi et al. In turn focus on the role of neoadjuvant therapy in facilitating surgery for advanced basal cell carcinoma. A 74-year-old woman with a large, ulcerated scalp basal cell carcinoma initially declined surgery due to social barriers. Neoadjuvant vismodegib, a sonic hedgehog inhibitor, reduced the tumor, enabling successful Mohs micrographic surgery with clear margins. A systematic review of 5 studies involving 105 patients and 110 tumors found neoadjuvant sonic hedgehog inhibitors achieved 49% histological clearance following MMS, with recurrence rates of 11% in successfully treated cases. However, results varied widely due to tumor complexity and study limitations. While sonic hedgehog inhibitors can facilitate surgery in advanced BCC, their inconsistent clearance rates and side effects, including fatigue and alopecia, necessitate careful patient selection. Larger prospective studies are needed to refine protocols and validate long-term outcomes.
We next highlight a report that further clarifies the genetic and clinical spectrum of CYLD cutaneous syndrome. Hersent et al. Contribute to this month's issue with a report that further clarifies the genetic and clinical spectrum of CYLD cutaneous syndrome. CYLD cutaneous syndrome is a rare genetic disorder caused by CYLD gene mutations, leading to multiple skin tumors such as cylindromas and trichoepitheliomas. Previously labeled as separate conditions, including Brooks-Spiegler syndrome, familial cylindromatosis, and multiple familial trichoepithelioma, these are now recognized as variations of the same disease. Researchers identified a novel CYLD splicing variant, C.2241 plus 5 G to A, in 2 families with distinct tumor patterns, confirming no genotype-phenotype correlation. The variant caused a frameshift mutation, resulting in a premature stop codon and loss of function. While most CYLD mutations lead to tumor suppressor dysfunction affecting nuclear factor kappa B and WNT pathways, clinical presentation varies because of genetic and environmental factors. Despite evidence supporting CCS as a single disorder, major databases still classify its subtypes separately. Experts urge updating terminology to reflect its unified nature and broad phenotypic spectrum.
We conclude this month's episode with a letter by CO et al., exploring a potential therapeutic approach for senile purpura. Senile purpura, marked by recurrent bruising from minor trauma due to weakened dermal collagen and fragile blood vessels, may benefit from calcium hydroxylapatite injections. In a study of 2 men, diluted calcium hydroxylapatite injected into the hands improved purpura, skin texture, and volume within 3 months, with histological evidence showing increased epidermal thickness, collagen, and elastic fibers. YAP expression, a mechanotransducer regulating collagen synthesis, also rose following treatment, suggesting that calcium hydroxylapatite activates YAP-mediated mechanotransduction to restore dermal integrity, while promising further research is needed to validate long-term efficacy and broader applicability.
We hope you have enjoyed this month's highlights. To explore these articles in full, visit the International Journal of Dermatology online. Until next time.